But this person says, we hear so much about the lack of estrogen influencing this predicament of painful sex. But I've also heard about the role of testosterone and progesterone. What should women understand about these hormones, and what should we be asking our doctors about them? And I assume she may mean, you go into an office and you are having this experience, and you're wondering, what specifically can help a doctor sort of figure out what you need.
Okay. So I'm going to go back to the point then to say that the majority of pain with sex, especially in menopause, happens at the vaginal entrance, which I referred to earlier. It's called the vaginal vestibule. And it's that transition zone between the labia and the vagina, the vaginal canal. That area is, again, so many hormone receptors in it, but also there's muscle and connective tissue. That pelvic floor is right behind it. So when you're having pain with sex and it's happening at the vaginal entrance, it's usually for a couple of reasons. One is hormonally related, right? We talked about that. Low estrogen, low testosterone, sort of a setup for low lubrication, thinning and drying. Ultimately, you can get narrowing of the vaginal entrance as a result of that. But in addition, the pelvic floor and the muscles behind that vaginal vestibule, that is also rich in androgen and estrogen receptors. And those muscles are smart. They want to protect you from what they know is going to be painful, right? A painful experience. So what happens is, a woman has painful intercourse and, she just keeps doing it because she wants to, be close with her partner. And she thinks, it's important for her to do this. And so she just keeps doing it and keeps trying. Well, the muscles get smart and they start to spasm and contract. And that spasm and contraction, that pelvic floor high tone over time can become a problem unto itself. So a lot of times when we're treating pain at the vaginal entrance, we're applying local hormones to sort of replace and heal the tissue, but we're also using vaginal dilators. We introduced sort of a series of cylindrical, plastic dilators or silicone dilators that can help stretch that muscle that's kind of gotten tight and thick and, kind of sensitive. It can be very painful when you push into that muscle. A woman will respond with, like, ow, I didn't even know that was hurting me, kind of thing. And so, I think that to point out, to get to your question about how do I approach my doctor about this, I think the problem is, and I hear this from my patients all the time, right, that they said, oh, I brought it up with my doctor, but she said, oh, just to relax or that this would get better. And I think that people aren't really being specific enough about what is hurting them. You should think about, go in prepared to say, first of all, are you comfortable if I ask you a question about painful sex, or, to preface it so that somebody knows it's coming. Yeah. I would also recommend bringing it up before the exam, because that gives, the provider a chance to really focus his or her exam on the vulva and not just throw that speculum in, right? I've heard it said that people treat the vulva like a town in the Midwest, like they just drive through it on the way to something else. And really, these doctors, they put in the speculum because they want to do your pap or get in there and make sure you don't have cancer, which is so important. But they don't really take the time to do a close-up vulvar exam, and that I think would really, show a lot in terms of what's happening with the patient, and things wouldn't get so bad. So to point out, to say I'm having pain during penetration, and then after penetration the pain gets better, or it's painful the whole time, or penetration's fine, but when he's deep inside of me, or the toy or the vibrator is deep inside of me, I feel a deeper pain. So to really be specific about what's bothering you can really help your provider to narrow down, especially if they're not that familiar, can really help them narrow down where to focus.
Yeah, I love that you just, in answering that question, I think really remind women to be as open and honest with their healthcare provider as possible. And it is really hard. I feel like we are kind of the first generation of women who are talking openly and publicly and honestly about this season of life anyway. But that doesn't mean that we're all seeing physicians who are of like mind or comfortable in these same conversations. And not that I'm blaming clinicians, but I do think there's there's a lot of anxiety about walking into your doctor's office, even one that you love and you've known forever and have a good relationship with, and saying, intercourse hurts, or I don't know, whatever, I'm bleeding down there, all kinds of things. So I just love that you're encouraging us at the end of the day to say what needs to be said.